Hi there, I'm Sonal Mehrotra Kapoor. You're watching me on NDTV. Now, regarding COVID, the biggest talk at the moment is when will the third wave hit us and at what intensity? And on this topic, lots of projections are now being made. Lots of scientist groups and professors are doing their own calculations over when the next wave is going to hit us. And recently, a very credible survey and derived from a formula called the Sutra model has surfaced, which gives you an estimate of the time when the wave is going to hit us and also gives you an estimate at what intensity the wave is going to hit us. Why I say this is credible is because it is a group of two IT professors and one Lieutenant General who actually got the first two models bang on. They used the same formula, if one can call it that, and made some predictions about the first wave and the second wave, and that fit in entirely true. That's why when now they have made their prediction about the third wave, it is seen with a lot of interest. Also, why it caught our attention was because remember, on FYI, we had earlier done also a show with Professor Babu, who had made his own predictions about third wave and what dates he gave us and what dates this Sutra model gives us is exactly the same again. So without any further ado, in this video, let's tell you what exactly is the Sutra model all about, and if this is true, then when is the third wave going to hit us? First, let's try and understand how they made their formula. Their formula is based on 4 key factors. Number 1, they have looked at the R factor, which is the reproductive rate, which basically tells you at what rate is the virus going to multiply and thus how infectious it's going to be. The second is going to be the vaccination numbers. Remember, India has a very high target, a very ambitious target of vaccinating all adults before the end of this year. And they looked into how possible these vaccination numbers are and how much are we more likely to achieve depending on the current supply. Then they also looked at possible reinfections, very important, because remember, those who already got their first jab, in fact those who got their jab right in the beginning of the vaccination drive, those are our frontline workers and our healthcare workers, what happens to their immunity by the time they come down to the third wave? That is going to be very crucial. That is what they factored in, and lots of fascinating data there. And fourth, perhaps the most unpredictable factor which nobody can really anticipate at this point is any new highly infectious variant coming into the picture. They make this model by also telling you that look what happened in the second wave, why it was so deadly and so infectious, both because there was a new variant, so it was, and there was unlocking, and there was lack of COVID appropriate behavior, and these 3 factors put together is what really gave us that massive spike of second wave, and we saw 4 lakh cases almost every day. In fact, that variant so bad that India got through that wave and now the world is still suffering. The world is still undergoing it, and there are still lockdowns being put and lifted in other parts of the world. So these are the 4 basic factors and pillars on which they have derived this formula. I won't get into the mathematical details on how exactly they arrived at a decision, but what exactly is it that they have predicted? Now, the Sutra model actually says that the third wave is a unique scenario where they also had to look at seropositivity to see how many people are already have antibodies apart from vaccinations, etc. So, keeping all those ifs and buts and fluctuating matters in mind, they have come up with basically 3 scenarios. One is a very optimistic scenario, one is an intermediate scenario, and one is an extremely pessimist scenario. Okay, let's talk about the optimistic first. The optimistic scenario, they say that in a scenario where life goes back to normal and there are no new mutants, no new variants that come into the picture, daily case range at the peak of the second wave is going to be between 50,000 and a lakh. Okay, that's your optimistic scenario, that we continue to vaccinate the way we are vaccinating right now. There are known new variants that come into the picture, and there seems to be, not very major sort of events like we had in the Kumbh Mela or like we had in our elections as well, that there is no super spreader. In that scenario, very optimistically, we'll land up with an intensity of third wave, which will be about 50,000 to 1 lakh cases every day. Let's get to the second scenario, which is the intermediate scenario. In this, they say that the vaccines, they are 20% somehow less effective. Now, they're not talking about a very new variant coming in, but imagine this situation. Right now, we have another variant of concern, which is Delta Plus in the country. And they say, and we don't have enough data to say whether or not vaccines work, not work, will this jump immunity, or will this escape immunity, what is going to happen? So in this, the scientists are saying that in case a scenario, and they've taken an estimate of roughly 20% less effective vaccines, there also the daily caseload remains to be between 50,000 and a lakh. They're not seeing any major fluctuation there. But then there is the pessimist scenario. And in that scenario, they say this is a condition where they've seen that there is a new mutant that comes into the picture, 25% more infectious, and our vaccinations still continues to be, however, at the pace with which it is going right now. In that scenario, the pessimistic scenario, also they're saying that the caseload daily at the peak of the third wave will remain to be between 1,50,000 to 2 lakh. So what does it say? It basically is saying that the third wave, even the worst scenario tabulated by this particular model, it is going to be half of what you have seen in the previous second wave, which is great news. Relatively, at least, great news that even in the worst case scenario, according to this model, I'm underlining again, the intensity of the wave is only going to be half of what we have seen in the second wave. And also it will be much higher, though, just to put in perspective, if we are talking about relatively much more than what we saw in the first wave as well. So these are the three scenarios talking about the intensity of the wave. But what about the date? Let's cut to that climax now. And that is where this is the second credible study and a paper that has come down by a group of scientists who have both, like Professor Babu did earlier, and now these IT professors as well, saying that the peak of this third wave is likely to hit us between October and November. Two models, both indicating between October and November, somehow telling us that just around Diwali, we are going to see the third wave of COVID-19. So what should you really be doing about this? Well, number one, get yourself vaccinated. That is the key. The study goes at length to talk about the relationship between vaccinations and the intensity of the third wave. Lesser vaccination, more cases. Lesser vaccination, more deaths. Lesser vaccination, more people hospitalized. Lesser vaccination, more the peak of the third wave is going to be. That's how crucial our vaccination numbers are to how the third wave and how the pandemic is really going to turn out and pan out in the future. That's key. And the second key thing is going to be our own COVID appropriate behavior, which will then in turn impact the R factor and so many other things, reinfection rates as well. And that is something that has not changed from wave 1 to wave 2 to wave 3, which is just double mask, do not go out unless absolutely necessary, and maintain your distance. These things have not changed, and this is something completely in your hand. So ensure that you're doing that. Also, if people still not clear about the impact of vaccines, let's tell you this, that the same group of people did study of how the new waves now post-vaccination are coming in the world. So this is a paradigm shift, right? So far, all the waves we saw across the world were before the vaccination process started. Now it's time to see whether or not vaccines are working. And guess what is the outcome? In UK, At least in several other countries also the trend is the same, but in UK specifically we've seen that how at the moment during this current wave in UK the number of cases and the number of infections have gone up, but their death rate is quite low. People in hospitals quite low, not matching up with what it was last time around, thus telling you vaccines do work. And the best vaccine is the one that is actually available to you. So that is what the Sutra model is all about, and these are again, remember, predictions that they have made. In fact, when I spoke with the scientists, they said that they will be revising their data in a couple of months' time from now when they have more inputs coming in, like seropositivity, vaccination numbers, etc. That will give them, that going along the way will keep giving them a more clear picture of how these vaccines are going to work, and also giving us a better picture of how the virus is going to work, with the caveat that the virus is extremely unpredictable, and the only thing which is predictable at this point and in our hands is our own COVID appropriate behavior and vaccination. That's it from me. I'm Sonal Mehrotra Kapoor. We'll see you in the next video.